Buenas tardes a todos. Good afternoon, everybody. It is a pleasure to be here with you all. And please keep the chat lively. Me and Sarah love a lively chat room. So anytime you have questions, we'll do our best to address them as they come up. And don't worry, there's no dumb question. Today, this is the second part in a two-part training series on outreach planning and outreach data collection. If you missed the first one, don't worry. These are pretty much standalone trainings, but you can definitely go back and refer to the first one. It's recorded and it's available on our website. All right, so today we really want to cover two main points, and we'll give you a couple of tools for these points. So one is we want to talk a little bit about data privacy and data security. We won't so much focus on HIPAA and health information. We're really going to focus on more about knowing where farm workers live and immigration status and some of those other data privacy issues. And then we're also going to cover two different types of software that you can use to make sure that you're building institutional knowledge and institutional memory about where farm workers live, where they work, where they shop in your community, so that if your outreach team, you know, every organization has like the abuelita or the mom that like knows where all the farm workers live, and she knows when they get off work, and she knows where they go to buy groceries. And so this is really about making sure that you have the infrastructure to keep that information in your organization, and it's not necessarily relying on one person's memory. In the first training, we covered two tools. I'm not going to go into a lot of depth about those tools because you can view that in the recording, but I will show you one for any of you that missed the first training. One of the tools we used was the MapQuest Route Planner, and that was really to help you, you know, if you have a series of outreach sites, like let's say you want to go visit 6 or 7 different H2A work sites in a day, you can plug in those addresses, and this will help you build an efficient route, which if anybody's done outreach, they know that's a huge pain and takes a lot of time. So we can drop this link in the chat so that you guys have it. The other one that I have is the Trala H2A data tool, which I am just going to briefly show. I need to reshare my screen here. So that tool was developed by Texas Rio Grande Legal Aid with some programmers. It's a fantastic tool if you didn't see it in the first training. But basically what it does is it'll give you all the information you need to find where H2A guest workers are in your area. And so this, I have it pulled up right now for Texas. And so this tool that anybody can use and access will let you pick a month. So let's say November in the state of Texas. And then I'm going to be able to see where concentrations of H2A guest workers are for the month of November. So I can see that in Texas, most of our H2A workers are up here in the northern corner of the state. So it's a super handy tool, and we can drop this link in the chat as well. Hope Lisa already beat me to it. Good job, Lisa. Okay. So those were two tools that were covered in the first part. Let's talk a little bit about privacy considerations and data security considerations. I'm curious if you guys want to start dropping in the chat. I saw a lot of folks were from health centers, and a few folks were from non-healthcare service providers. So if some of you want to drop in the chat, if you're part of a HIPAA entity, which would mean you're a healthcare provider, or if you're not, feel free to chat that, because it is a really different process. The main thing to consider, and what we've found, every organization works differently, right? But what we found is that with outreach workers who are working with folks who are working for healthcare organizations, a lot of times those outreach workers don't necessarily have access to the EMR. And so they're recording information sometimes in not very integrated ways, and they're just kind of doing their own thing sometimes. Other outreach workers do have access to the EMR or certain, you know, subsets of the EMR. And so it really depends on your organization. But this is really about, when we're talking about these tools for outreach data, what we're really talking about is independent ways that outreach workers can record where they're going and who they're interacting with farm workers. And so they're not necessarily recording health information, but they are recording where farm workers live. They might be recording how many of them are there, when they get off work, maybe some healthcare resources that they might need, and things like that. I think the biggest concern with this type of data is recording where farm workers live and work, and recording any type of information about the immigration status of those workers. It's a little bit less of an issue with H-2A workers because they're all present legally. But for workers that are undocumented, it's a much bigger concern. So you want to be really careful about what information you are recording when you record any of your outreach locations. Some other tools when you're out in the field talking to workers, you want to be careful not to leave any papers with personal information, any iPads or laptops in your car. You don't want to bring all those workers' phone numbers that you just collected and take it to a coffee shop and work on it there. You want to be sure to do that in a non-public, secure setting when you're working with that type of personal sensitive data. When you're back in your office, you want to make sure you have a locked file cabinet to store any hard copies of information. Or if once you put it in your computer and you get rid of the hard copies, you just want to make sure and use a paper shredder. A few other things that are tricky is you want to make sure to not share accounts as much. Your organization may have certain rules about that, but generally you don't want to share any accounts. You want to avoid using Google Docs for any personal or sensitive information. And you want to be really careful about what you're sharing over email or text messages or voicemails. I think we have a question from Tyrone. Tyrone, if you want to put that in the chat or unmute yourself, either one is fine. Well, you can interrupt me anytime. Sometimes people put their hands up because it's an accident. I'm going to keep going, but jump in, Tyrone, if you have a question. All right, we are going to do a short activity. And so we're going to put this link in the chat, and we're going to use a Jamboard. And so on here, you're going to see a board, and I'll bring it up once we have the link in the chat. There we go. You guys are going to put what types of tools you have been using or the ways that you have been collecting data for outreach in your organization or on your own. So once you go to this link, everybody can access these little sticky notes, and you can make a sticky note and say like, okay, I use Kobo Toolbox, the one we're going to show you today, and it'll add it, and then you can drag it on wherever. So take a few minutes and go ahead and add what kinds of tools you're using for outreach right now. Good, so we have a Google Maps, super important, right? What do you guys do? How do you find those housing locations that are not where they are supposed to be? Or they're tucked behind a granary or something? Paul tricks, that's good. Okay, cool. Excel spreadsheets. I'm gonna add this up here. Good, the licensed camp list, that is good. Vamos app, I'm curious to hear about that. I think I have heard it mentioned. Is anybody already using H-2A job orders? Awesome, few of you are, it looks like. Talking to local hospitals, that's great. Yeah, I mean, partners is a great way to go. Cool. MailChimp, interesting. Okay. Is anybody using WhatsApp, you know, like to talk to crew leaders or things like that to plan their outreach trips, when they go, who they visit. Awesome. Ismail is good. Okay, great. We rely very heavily on WhatsApp here at NCFH. Good. Okay, I'll give a few more seconds in case anybody wants to add anything else to this list. Yeah, post-visit too is a great way to follow up with workers. Awesome. You guys are super savvy. Google Forms. I like that one. Facebook. Cool. Okay. Great. All right. So this is cool. So a few of you mentioned using Excel. Sarah right now is going to demo a couple of ways to set up and manage your data using Excel, because it is, you know, it's really common. It's really easy to use. A lot of people have access to it. A lot of people are familiar with it. So I'm going to pass it over to Sarah right now, and she's going to show you guys a few Excel tricks.
Awesome. Thanks, Bethany. Hi, everyone. I'm Sarah Prager. I'm the Research and Evaluation Manager. And as Bethany mentioned, I'm going to go over an Excel spreadsheet, or a couple different ways that we organize data, and then some tips on that data. And kind of the way that this worked, take this. So how we came up with this is over the past few months, 12 months, we've worked with over 40 community-based organizations across the country on different outreach efforts and helping coordinate vaccine clinics and general outreach to farm workers around COVID. And so this was kind of something we are asking for a lot of different metrics. We wanted to make sure that we were demonstrating not only that impact, but also the reach of these efforts. Y'all are probably very familiar that reporting is a big thing, and kind of, you know, we're always wanting to, demonstrate that in order to, whether that's allocating more funding, internal processes, all of these things. And so folks had lots of different ways that they were collecting this data, and this was one way that we offered them, especially since we heard a lot of, we're using paper and pen. We have all these community health workers out in the field, and then we're getting all of these different ways that they're telling us the different places they've gone, or the different totals of people that they've chatted with or seen. And so we helped kind of develop this in order to organize that data. So it may not be completely relevant to what you do, but it's a good starting place, especially for folks that are using a lot of pen and paper, to organize everything together and then always, adapt as sees fit. So kind of to start with, in this, there's 3 different sheets. The first is this, I kind of call it a cover sheet, but maybe it's a snapshot. And this is where all of your data comes together. So we'll get to that last. The other 2 sheets are how we actually collect the data. So the first one here is this outreach event. And in this case, we're collecting data from multiple community health workers. And it's the metrics that we have in here are different totals. And then the other way that we heard people were collecting data was actually these individual interactions. And so it kind of depends, maybe you collect them in 2 different ways, maybe you choose one of them, but lots of ways to use Excel and set things up. So I'm going to go over kind of both of these and everything that's in them and different ways that they can be organized. I'm going to actually start with this example for the outreach events. So in this case, the way that we've set this up, and again, like most people or lots of organizations, can be done in lots of different ways. What we heard a lot is you have lots of different community health workers and they are finding different ways they need to collect or input data. So we set this up in order that, maybe they come in once a week and they enter in all the, all the work sites and places that they visited that week. And so in this case, it's, one community health worker a week in each of these rows and then one date for that week. You could do these lots of ways. Maybe, like Bethany mentioned, you really need to capture the addresses of places. So in that case, you may have one row for each address that you have. And then we have our metrics kind of in each of these columns. So the things that we were really looking to collect to help demonstrate reach were not only workers engaged, but specifically with H2A workers, the types of PPE distributed, any referrals that were going out, and in some cases when outreach was coupled with vaccine clinics, some of our farm workers actually vaccinated. And then, and so those are kind of the different metrics. And like I said, every row is kind of a new week and the date. One of the important things that we made sure, and that is important when you set up a spreadsheet in this way, is that you have one type of data per column. So, we're talking about number of workers engaged, and we have 22, and we're not saying 22 workers, we're just saying 22 because we want Excel to do everything that it can on the back end to do all the work for us, basically. And so that way it's gonna, I'll show you in this monthly kind of snapshot of things, we're able to aggregate all of this different data. So that's one big important thing is, a different row for every, or a different column in this case for every metric, and to have one kind of metric. So in this case, these are all quantitative or numerical. And again, you may have ones where you have, a yes, no, things like that, and just making sure that that's consistent, which I'll show in just a second. And so kind of one of the ways that you could do this kind of in use cases, the way that we have, where maybe you have a shared spreadsheet and a community health worker, every community health worker has access to it. They come in at the end of the week, they input the date, and then they go ahead and they total it up. Or maybe you have one person that's managing all your community health workers, and maybe they really like using the pen and paper, and they send those to you, and then there's a central person that's going to input it all into this spreadsheet. But the main point is that you have one way to collect all the data, and then it's consistent, and then you're able to kind of do these sums. So for example, because we're able to have each, we have the date here, which has to go in there, and it's only one date, also very important. Then in these cases, we can do sums and things like this. So again, we have different dates for May, different dates for June, but we're able to say, okay, for the whole month of May, this is kind of our total. And over time, this is our year to date. Up through August, this is where we're at. And so that's kind of why you want to set that up in that way. So again, lots of different ways that you can put in this or do this. You could have it, one community health worker for every work site. You could have it every time they go out, all of that kind of thing. But the main thing here is this is totals. These are events, whereas the next one I'll show you is an individual interaction. And if you have questions, feel free to add those into the chat as well. So this one, unlike, is every single touch. So in this case, we're going to have every row has its own farm worker. And again, really important that you're very consistent in the way that you're collecting this data. So in the first one, it was once a week. In this one, it's every single person. And we have, you may be collecting personal information of them, or you may not be. In some cases, you're just trying to quantify the reach, how many people you're reaching, the kind of flyers you're doing, all of that kind of stuff. But if you're needing a follow-up, that's when you have that personal information. And again, keeping in mind all those things that Bethany talked about privacy. And so in this case, the organizations that we were working with were collecting a lot of different data. Some of the stuff that we were collecting was different types of education that they gave out, if they offered the vaccine, and again, that one type of data per column, we offer different things if they offered it versus what they offered. And that's so that you can do things like filter, you can sum up, again, all of those totals, but keeping those things separate. And then also we collected data around different services that they provided. So were they offering quarantine or self-isolation, for housing for quarantine? Were they offering wages for any lost wages? All sorts of different things, PPE, testing. And then the other thing in this, again, back to kind of that one type of data per row, is in here, we've put restrictions on the kind of data that go in each of these cells, which is really important when you're collecting not just numbers, but kind of different things. So we set this up so that it's easy for someone to come in here and it kind of reads. You don't have to think about, okay, what kind of type of information, and then you might have different community health workers might answer that in different ways. So instead, we offered these drop downs so that it's almost like you're filling out a survey or something like that. There's only so many things that they can actually put in each of these cells. Same with this yes, no. All of these kind of ones that are not numbers, they're lists that people can put in. And you can do that with this data validation within Excel. And if folks have questions more about that, I can show that, but don't want to take up too much time. But it's good in general just to kind of restrict those cells when you're having multiple people work in a single Excel sheet so that your data is clean. You don't have to go back afterwards and kind of clean it all up. So that's kind of this individual interaction. Really depends how you're going to, if you want to collect personal information so that you have that follow-up. And again, a big one are these dates. All right. So those are the two different spreadsheets that we use to actually collect all that data. And again, this one, for example, you may have where every community health worker has their own spreadsheet where they just map this out, put in one row, one farm worker, and then you total those all up together in this monthly kind of snapshot. So in this one, this is what's called a protected worksheet. So you actually don't enter any data into this spreadsheet. It has all these crazy formulas in it. It's only pulling data from other worksheets to give you that snapshot. I'm obsessed with having this kind of snapshot in any kind of data. It helps just give that overview. If you have benchmarks that you're trying to meet, you can do like progress bars, things like that. In this case, the organizations that we are working with were really just doing, they were doing monthly reports. And so we needed to sum up for every month. And so while these, the dates go on forever in one sheet, we're able to give those monthly totals separately across every single metric. And then at the bottom here, we have the year to date. So that kind of sums up everything that's happened up to that moment. And so that's kind of your snapshot. And again, you can make these as fancy as you want. You could have, we have some that have charts in them, progress bars, all that sort of thing to really visualize your data. And I think that's all I have on this tool. And again, it can be adapted in lots of different ways. Folks have any questions specifically about the tool? All right, cool. I will move on. Bethany, if you want to go back to the slides.
Yes, I will. And you had quite a few requests for the template.
Yes, we will send that. I will say when we send the template, we'll send it, but if it's right now, it's designed, so it's just through 2021. So please reach out. Our emails will be at the end with the contact information. If you're looking for one that expands past that, because it just takes some changing the formulas. So generally kind of just as you adapt things or as you build your own spreadsheets, rule of thumb, one type of data per cell. This really helps Excel do all the hard work and you just kind of creating formulas, things like that. That data validation, piece of things in Excel really helps with keeping your data really clean. So you could, make it only whole numbers, or you can make it lists, things like that. If you have formulas like in that monthly snapshot sheet, make sure to protect those and lock those sheets so that if lots of people are using, then they aren't able to go in there and kind of, maybe accidentally erase your formula or things like that. And then, again, being consistent with how data is collected. So in that outreach event template, if you're looking to do maybe you want to collect every single work site you go to, just making that really clear in your protocol and so that everyone knows that's how it's being collected. And then finally, just kind of rolling up your data in that snapshot so that you have your progress towards goal. You can sum up metrics. When someone like your funder asks for a report, it's right there, at your fingertips. You don't have to look for it. And then I think there was a question.
Mm-hmm. There you go. Yeah, Gina, if you have a question, just let us know.
Formulas. Yes. I can definitely send out some stuff in kind of different ways, potentially, different things that you may want to use. And then honestly, it's like you have an idea and I'll go to Google, and Excel has unbelievable amount of tutorials that show you how to put in those formulas. But I'll send these out, and then also I'll send out a version that unprotected so that you can see the formulas within the cells and see how those were added up. Any other questions? All right, I'll turn it over to you, Bethany.
Okay, I'm going to show a really fun tool. Oh, you have one more question. Let's go ahead and get that, Sarah, before I move on. Mariah?
Yes. Yeah, so Mariah asked what recommendations we have to learn about Excel, suggestions for specific trainings, webinars, or is it Googling and YouTube? I've taken some standard, trainings or things like that, but oftentimes I feel like the best is when you want to accomplish something in Excel and you Google how to find it because you actually have a use case to use. But I think, so that's a big one, is just trying to think about, okay, what do I want to do? And Excel can probably do it for you in most scenarios. It's wild how sophisticated Excel has gotten at this moment. But also if you have questions, NCFH is also here for TA, and I'll drop I think Bethany dropped it in the chat, my email, and feel free to reach out to me and we can kind of noodle through it together as well.
All right, great. So yeah, Excel is awesome, especially at supporting paper and pen data collection and doing that kind of reporting that Sarah mentioned. It's so handy for that. We're going to show you guys another tool called Cobalt Toolbox if you prefer to be all electronic and move away from the pen and paper data collection. So I'm going to put this link in the chat right now. Oh, there you go, Lisa. Thank you. But it's a free tool, and it's basically a little more sophisticated version of Google Forms if you already are using that. So let me show you what the end product looks like, and then I'll show you a little bit about how to build it. So this is a little sample data collection form, and these you can customize any way that you want. But for me, when we go into outreach, I really like to collect data by the work site, right? Especially with H2A workers, we found sometimes it's really hard to find exactly where their housing is. Sometimes it's half a mile away from the address on the job order or things like that. And so a really cool feature of Cobalt Toolbox is that you can put in exactly where you have found their housing site, and you can do that manually. So for example, I can type in an address and look for it on the map, and then I can drop a pin right there. Or if I'm using this form on my phone, I can use this form on my phone as well. And if I have my location enabled on my phone, it'll find exactly where I am, and I'll be able to drop a pin. And so I'll be able to keep the exact latitude and longitude of that Farmworker housing site and keep that with all my other information about that housing site or about that work site. So you'll see here, like, let's say that, you know, the farm worker's house was supposed to be over here, and let's say I found it back here behind this little lake. And so I'm going to drop a pin right there. So I'll know exactly, if I need to send another coworker out there, they'll know exactly where to go. And then really the rest of the form, it just works like any other form. You will just input any information you need. And the nice thing about this form is that you can collect data offline. So if you're using your phone and you're in a spot where there's no cell service, you can go ahead and put in all the data and it'll save it for you. And once you reconnect back to Wi-Fi or cell service, it will upload it to your online storage. So it's really handy for that. So let me just go ahead and enter this information in. The other cool thing about Cobalt Toolbox is that if you have any photos or audio recordings or videos, so maybe you need to take a photo of the housing site, so more information for your coworkers to be able to find this location, you could take a photo on your phone and upload it to the form. Or maybe if you work in legal services and you had a negative interaction with someone on the farm and you recorded that, you could attach that to this file. So any host of different things, you can attach it here, and it's really, it comes in handy. So this is going to go ahead and submit it, and I'll show you what it looks like on the back end. So once you sign up for Cobalt Toolbox, it's all free. Then it's going to let you build a form to collect information. So you can use a template that they have. You can actually, if you already have an Excel file, like what Sarah was demonstrating, you can upload that Excel file and it will kind of draft a form for you based on that Excel file. But for this one, we're just going to build from scratch. So we'll give it a name. And it's super easy to use, which is really nice. So if you want to add a question, you just click this little plus sign. And I'm going to add it, and then you're going to pick what kind. So you'll see on here, there's a ton of different kinds of questions you can add. I'm looking for the little location one. So you can see you can add a whole bunch. Oh yeah, so right here, point. So if you want to add that map feature that I showed you, you would add the title and then you would click point and it will add that little mapping feature on the form. And so same thing here, if you want to add photos to upload, you would just click add question and you would find what you're looking for. So here's photos. So there's a whole bunch of different things. You can have QR codes, you can have a time or a date and time. You can have a lot of different options, and it's really handy and it's really easy to use. So, and then as you're going, if you want to preview it, you can click this little eyeball to kind of see how it'll look once you publish it. So there's my little demo form. And let me see here. So once you have collected information, it will give you a little reporting feature. So this sample outreach form I can see all the times that I have entered data in here and all the responses. I can see it in a report format, so that kind of like SurveyMonkey or Qualtrics, if you've used those items before, it'll summarize the answers for you, summarize all the entries. If you have attached photos, it'll give you a gallery so that you can see the different photos that were uploaded. You can download all the information as an Excel file. And then if you have inputted points on your map, it'll bring up a map of all the different places that you've pinned. And it'll also let you change and filter those things. So if you have marked things as work sites, housing sites, community sites, then it'll come up and it'll show in different colors. on the map. So it's a really nice way to share with the team all the places you've been and what types of sites those were that you visited. Okay, any questions about Kobo Toolbox? Alrighty. It's really fun. You can play around with it. And yeah, it's really handy. I've used it in the field a lot. And I told folks last time they were nervous, about using it offline. And I've used it to collect about 2,000 surveys with workers in the field. And we used it offline a lot. And we lost one survey one time. We had it didn't go through and it erased the data. But all the other times we didn't have any issue with the data uploading. So it's pretty reliable and we've had a good experience with it.